you've talked quite a bit about scans while we've been here, and I think one of the bees in your bonnet is whether scans are absolutely necessary for these conditions. Talk to us a bit about that. When would you, seeing a patient, if you were seeing a patient on first contact, as it were, which you don't at the moment, but when would you say, I've got to send you off for scanning?
So, Stephen, I think the thing is, it's about education to the patient. And I think a lot of our patients, it's a great thing, isn't it, when you can Google everything nowadays. And I think they come in with a preconceived idea that an MRI or a scan is going to change their management. I would only use an MRI or an ultrasound scan really if I think the patient's going to require surgical intervention. And if I don't have to have that, I can use my clinical assessment and my reasoning skills and my assessment of the patient to guide me about what I think is going on with that patient. So again, the other thing to bear in mind is you can get findings from an ultrasound and MRI that actually isn't the cause of their pain. So I mean, for example, I saw a lovely lady. She'd had an ultrasound scan about 6 months prior. I was told she had a partial tear of her supraspinatus. She came in to see me. Hi, I've been referred to see you. I've been told I've got a partial thickness tear. I think I need surgery. But when we actually looked at her and I assessed her, her symptoms were actually cervical related. And as soon as I started treating her neck, can you see, all her pain went. So it's again going back to that. Sometimes we see these things, but it's not the cause of your pain. And I think sometimes that can give patients the wrong information. So scanning can be useful in the presence of trauma if I think that patient's going to require surgery. Okay. That's when I tend to use it.